probably wouldn't appreciate that very much at all. And just think of the difference if you walk into that client's room and you explain to them and talk with them and say, Mrs. Jones, this is Jennifer. I'm going to help you turn from your back to your side. We'd like to help you try to keep pressure off of your back and just change your position a little bit. I'll explain to you how we're going to do that, and I'll make sure that you're comfortable before I leave. And just think how much more reassuring that is for them, that they know what you're doing. The other thing is that it just gives them a sense of respect also, that you're caring about their feelings. So explaining to them and realizing that's not going to take you really any more time. You can talk as you're elevating or lowering the bed. You can talk to them as you're getting the equipment together. So it's not going to increase the amount of time it's taking you to care for that patient, but it makes a big difference to them. Privacy, of course, is very important as well. These patients, even though they are in a hospital or nursing facility, they need to feel that they're respected and that they deserve every bit of privacy, the same amount that we would expect in those situations. So if you're using a bath blanket or a sheet, whatever you need to, even if you need to grab another one, make sure that you keep them covered and that you're not exposing them when you're doing positioning changes. And finally, always adhere to a schedule. If there is an established schedule, it may be in the care plan. It occasionally is on the wall of the patient's room, but be aware of that so that you know how often that patient is supposed to be turned or their position is to be changed and into which position is the correct position for that time. Now, when you're positioning clients, there are just some basic body positions to be aware of, the positions that you will be using when you change them to different positions. One is prone, which means on your abdomen or lying flat on your stomach. Another one is supine, which is on your back. The third one is lateral, on your side. And the fourth one is Fowler's, which means a sitting up position. All of these body positions that you may put your clients in, you always need to be aware of their body alignment. You may change their position, but you need to be sure that no matter which of those positions they're in, that they are in correct alignment, that their body is in a straight line, that their joints are in proper relationship to the joints around them, so that hips, knees, ankles are all in good alignment and one isn't twisted or moved out of position, so that it's uncomfortable and so that it causes stress and strain on the joints and the tissues. I'd like you also just to be aware during the demonstrations that there are different turning methods. So watch for these. There is the use of the lift sheet, where you can use the lift sheet to help roll or turn the patient. There is the leg crossing method, and that's where you will have the client cross one ankle over the other, and that just assists with the rolling. They'll cross their ankle over the other one, then you will place your hand on their hip and their shoulder from the back and help them to roll. And the crossing the ankle just helps give some momentum in the correct position, the correct direction that they're rolling. Now, the last thing I'd like to mention before we do our demonstrations is that there are some extra care things that you can do, extra care measures when you are positioning your clients. One thing is a massage with lotion to their back and their pressure points. This does not have to be a long massage. I guarantee you your clients will be very, very appreciative for this if you take the time. But if you're turning them maybe from their back to their side, take a minute and just take some lotion, apply it to their back, apply it to the areas that may have had extra pressure on. Remember, they've been on those parts of their skin and their body for a couple of hours probably. So if you can take some lotion and just rub it into maybe the shoulder blades, the top of the shoulders, the tailbone where they've had pressure, maybe onto their heels and a little bit on their elbows, that will be very comforting to your client. And it also helps to just kind of give that circulation a jump start again after it's been decreased for a couple of hours. Also, of course, if you're changing their position and you notice that there are wet or soiled linens, you would change those. But also be aware of linens that have creases or that are bunched up. It's not only uncomfortable, but it's not good for the skin to be lying on linens that are creased or are uncomfortable in different areas to the skin. Oral care and offering fluids is another important thing. If you offer fluids every time you do a position change, that's a good way of knowing that these clients are getting enough fluid. It's also nice to offer them a chance to do some oral hygiene, some oral care. Many of these clients are on oxygen, which dries out the mouth. Many of them are mouth breathers, or they're on medication that's drying to the mouth. It's just nice to offer that so that they can have a chance to get their mouth cleaned and get some moisture in their mouth. And finally, toileting. That's a good time to offer toileting assistance. You would hate to come in and roll somebody onto their side and get them all positioned with pillows and braces and so that they're all comfortable, and then have them tell you, oh, but I need to use the bedpan. So that wouldn't really be their fault. You need to be aware that that's a good time to offer toileting so that you can take care of that before you put them into their final position. Now, I'd like to have you just watch closely as we demonstrate these positions for you.
Placing in supine position. Place the bed in a flat position. Place the client in the center of the bed and maintain privacy. Position the client's head near the head of the bed. Place a pillow under the head and several inches under the shoulders. Place a trochanter roll or other device to prevent external hip rotation. Place a pillow under the ankles to prevent pressure on the heels. Position feet at 90-degree angle against a footboard or pillows. Place arms at the side as the client wishes, with fingers extended. Placing in Fowler's position. Place the client in supine position in the bed with hips at the point where a mattress bends when the head of the bed is elevated. Elevate the head of the bed to 45 degrees, called semi-Fowler's position. Or 90 degrees, called high Fowler's position, as ordered. Adjust the pillow under the head for comfort. Place pillows under the arms to prevent shoulder strain. Place a pillow under the lower legs to lessen pressure on the heels. Flex the knee gouge slightly to keep the client from sliding down in bed. Orthopnic position. Position used with patients having difficulty breathing. Place the head of the bed in high Fowler's position. Lower the bed to its lowest position. Move the bedside table in front of the client. Place 1 to 2 pillows on the table for the client to rest on. Place additional pillows behind the back for support. Log rolling.